Welcome back at 9:14 on the Health Watch this morning. A new study published by researchers at Northwestern University finds a significant link between nitrogen dioxide pollution and people of color.
The nitrogen dioxide is a toxic gas emitted primarily by burning fossil fuels in vehicles and power plants. Historically, it's been linked to health complications like asthma and respiratory infections. Now researchers have discovered people of color are experiencing higher mortality rates linked to this pollution. Joining us now live via Zoom is Northwestern's Sara Camilleri, who led this study. Good morning, Sara.
Good morning. Thank you so much for having me.
A key finding is that you estimate 171,000 premature deaths a year are linked to nitrogen dioxide exposure. And based on your examinations of the various data, tell us more about the disparities discovered when it comes to communities of color.
Yes, exactly. As you said very well, NO2 is a toxic gas that comes predominantly from combustion of fossil fuels. And this means that large sources of it are cars or trucks, as well as power plants. And there has been previous studies that have shown that this NO2, the hotspots of this pollutant, occur in places where predominantly people of color live. When we then estimate our attributable mortality linked to this harmful pollutant, we also find that across the US, we find that predominantly Black communities experience NO2 attributable mortality rates that are around 47% higher than the national average. And that's substantial, right? And we know that that is also linked to not only the increase in NO2 concentrations in those neighborhoods, but that is also linked to underlying susceptibilities of those communities. And by that, we mean underlying health conditions and other socioeconomic factors that impact these population subgroups.
We're talking about largely urban areas and some of those other factors, not accessibility to good health care. Once you develop these conditions, I wanted to ask, is there an age range or a particular section of the African American or Black community who are susceptible to these things? Is it mostly older, or is it less and younger? As we see, a lot of these factories have closed now. Growing up, I saw a lot of them in the area, but they aren't around as much.
In this study in particular, we have looked at ages 30 years and over, but there are evidence for links to this harmful pollutant across all age groups, of course. And new epidemiological studies are continuously coming out, linking even higher relative risks for different racial and ethnic groups related to NO2 exposure.
You have some data specific to Chicago. So what did you find as far as the link between mortality rates and nitrogen dioxide exposure right here in this area?
So an interesting thing of the study is that we don't solely quantify the total CONUS impact, but we also look at the census tract level. So we really conduct our analysis at very fine scales, which then helps us to understand these disparities, but we can also then aggregate them to cities. So for Chicago in particular, we have looked both at the metropolitan statistical area, that's the city of Chicago and the surrounding suburbs. And we find that within that metropolitan statistical area, the rates are about 1.3 times the national levels. And again, we see disparities there, large disparities. So people of color are exposed the most. And then if we focus on the city of Chicago in particular, given that it's an urban area, we find that the rates there are 1.7 times the national level, and that's due to NO2 levels that are about twice the national level.
That is alarming. Very quickly, before we let you go, what do we do about this? What are the solutions to these mortality rates?
One solution that we proposed in the study is that if more stringent air quality standards are employed, then we do see that this number would go down to about 99,000, a reduction of about 42%. So if more stringent air quality standards are applied, then that's a large benefit. And some of our previous studies has shown also that targeted policies and incentives to shift to a cleaner fleet, specifically the truck fleet, and that would have large benefits both both from an air quality and health perspective, but also from a climate and economic perspective.
Understood. Okay, well, hopefully those initiatives will continue to be embraced by, urban areas and companies, et cetera. Sara Camilleri, thank you so much for joining us this morning. Now, this study was published in the Environmental Science and Technology Letters. It's supported by the National Science Foundation and NASA. We'll have a link to the full report, if you're interested, on our website, cbschicago.com, under the video tab.